The ability to lactate or provide milk for one's child is part of a woman's life cycle. It is considered today the normative method of infant nutrition. The goal of this video is to provide up-to-date recommendations to make this experience successful and enjoyable. Breastfeeding is also the norm in Tanakh. We learn about the breastfeeding relationship of Sarah and Yitzchak, Yocheved and Moshe, and Hannah and Shmuel. What is becoming better and better known are the health benefits of breastfeeding. The American Academy of Pediatrics, as of its 2012 statement, feels that breastfeeding should no longer be considered a lifestyle choice, but rather a matter of public health. Matters of public health are also matters of halachic concern. With what is known today about breastfeeding, it is clear that breastfeeding should be halachically encouraged. While breastfeeding is a natural activity, it is also one that needs to be learned. What you have here on the slide are some of the 10 steps to successful breastfeeding, interventions that have been shown based on evidence to help breastfeeding be successful. While circumstances can sometimes preclude some of these steps, the more of them you are able to do, the better chance for a smooth beginning. Breastfeeding, when done properly, is not meant to hurt. The baby's mouth is meant to be on the breast tissue and not on the more sensitive nipple. Pain is a sign of something not going correctly, and make sure to ask for help, either from a physician or nurse with experience in breastfeeding or from a lactation consultant. The sooner you ask for help, the sooner you're going to feel better. Current recommendations are for exclusive breastfeeding for the first 6 months of life, followed by continued breastfeeding with food added in for a minimum of 1 year and for as long as the mother and infant desire. These guidelines are compatible with Halacha, which assumes but does not mandate a breastfeeding relationship of 2 years. There are halachic reasons to stop breastfeeding by the time a child is 4 to 5. Once the baby starts eating a significant amount of solid food, it is likely that menstruation will resume if it has not done so already. Tzniut concerns should be kept in mind while breastfeeding in front of other people or in public, although they should not get in the way of your feeding your baby. You may find using a baby blanket or a nursing cover to be of assistance in this situation. It is permissible for a woman to daven, say brachot, or learn Torah while she is breastfeeding, although it would be better for those items of tefillah that need more concentration, such as Shmona Esrei or Shema, to take a little break. Breast milk does not affect the kashrut status of anything in your home. Breast milk is kosher and parv. In general, breastfeeding women fast on Yom Kippur and Tisha B'Av. However, this does not apply to women directly after childbirth, and a specific question should be asked. There is also room for leniency in the face of breastfeeding difficulties, or for women who know from past experience that they have difficulty with nursing after the fast. Once again, a specific question should be asked. It is preferable to ask all these halachic questions before the fast so one knows in advance how to proceed. Breastfeeding women are not required to fast during the minor fast. A frequent halachic question relates to pumping breast milk on Shabbat. While breastfeeding is clearly permitted, other forms of removal of breast milk, even by hand expression, are forbidden on a Torah level. However, when there is a need for milk removal for the purposes of the mother's health, either for relief of engorgement or prevention of breast infections, this can clearly be done as long as it is done in a way that the milk goes to waste. This can be accomplished in a number of ways. If using hand expression, one can simply express over the sink and allow the milk to go down the drain. If using a pump, one can put soap into the container prior to pumping, which makes the milk unusable. When the question is pumping on Shabbat to feed the baby, the halachic issue raised is pikuach nefesh or saving lives. This needs to be judged on a case-by-case basis, and an individual question should be asked. Modifications can be made to an electric pump to make its use on Shabbat less problematic. An individual question should be asked. We hope you have found this overview helpful.